Hi, and welcome to today's symposium, Rising to the Challenge, New York's Commitment to Children Amid Federal Change. I'm Kate Breslin, and I'm the President and CEO at the Schuyler Center for Analysis and Advocacy. And we're so excited to have all of you joining us today from around the state. We are so appreciative of our distinguished speakers and all of you who've taken time from your busy day to join us. We're grateful to be here together for what surely will be an engaging and important conversation. I hope that we can look for the bright spots, the moments of opportunity for New York to push forward to ensure that children and families are supported. Here's the plan. We'll hear from each of our panelists. Barbara Guinn, Commissioner of New York State Office of Temporary and Disability Assistance, Maria Doulis, New York State Deputy Comptroller for Budget and Policy Analysis, and Sophie Collyer, Research Director at the Center on Poverty and Social Policy at Columbia University. And then we'll have a discussion exploring questions we received in advance and that have come up in the Q&A. If you'd like to pose a question, please use the Q&A feature at the bottom of the Zoom screen. Nearly 4 years ago, New York State enacted legislation, the Child Poverty Reduction Act, that committed the state to reducing child poverty by 50% over the next decade. That legislation was passed with bipartisan and nearly unanimous support. Reducing child poverty is a goal we all agree on. While the state has begun to make real progress, federal actions threaten the progress made and pose serious risk to the stability and well-being of New York families today and for years to come. The federal government has taken numerous actions, budget, legislative, and administrative, to weaken services that New York families rely on in times of need. Food assistance, Medicaid, health insurance premium assistance, even access to data and more. And the federal government's non-targeted immigration enforcement sweeps and its budgetary and administrative actions to strip immigrants of even the most basic services has altered the daily lives of many New York immigrant families and communities. We'll focus today primarily on some of those that particularly impact children, including SNAP, the child tax credit, and disruption for children and immigrant family. We planned this gathering before the federal shutdown, planning to explore New York's response to the federal bill, the federal law HR 1, and other recent federal actions. And we recognize that the shutdown is on everyone's minds. So where it makes sense, we'll dig into that as well. Even now, as the federal shutdown drags on, nearly 3 million New Yorkers face the loss of critical SNAP benefits this weekend. That means 3 million New Yorkers who already struggle to put food on the table for themselves and their families will find themselves without SNAP benefits. Our children need New York to keep its promise and make sure all families have the resources they need. Lately, in so many conversations with our families and neighbors and colleagues, we hear, at least we live in New York, we know our leaders care about kids. We need to keep demanding that our New York members of Congress work and vote to ensure the federal government does not continue to abdicate responsibility for low and moderate income people who live here. Today, we'll discuss how state leaders can rise to the challenge of protecting families as our national leaders remove federal support for low and moderate income people. Investments in children are investments in the well-being of our state and our future. Now more than ever, our children and families need visionary leadership and clearly defined priorities from state and local leaders. For those of you who may ask, yes, we are recording this webinar, and we will share a link to the recording with all who are registered. So, before we hear from our speakers, we want to hear from you all, the audience. So, to start, let us know who's in the room by filling out this quick poll on your screen. So I hope you all can see this poll asking you, where in New York State are you joining us from? All righty. This is great to see. We have folks from all over New York State. Let's see. The winner is the Capital Region with 31%. And we also have a lot of folks from New York City. We have folks from Long Island, the Hudson Valley and Westchester, Central New York, Finger Lakes, Western New York, and the North Country. Welcome. We're so happy to have you here. So we'll come back to you with another question after we hear from our speakers. Commissioner Guinn from the Office of Temporary and Disability Assistance, welcome. You're up.
Okay, thank you so much, Kate, and thanks as always to this team at Schuyler Center. Always appreciate all the work that you guys do every day, both to educate, but also to advocate, come up with solutions to help all of us get to a better place in terms of how we support families, in particular children, throughout our state. Thank you for including our office in today's conversation. So yeah, as Kate mentioned, the Child Poverty Reduction Advisory Council was established. It's shocking to hear it was 4 years ago, but yes, so that work is certainly underway, and we're really pleased so far with what we've been able to accomplish. It's an absolute honor to be able to serve as co-chair and to work with the council members, including Kate and others who are really taking their time and lending their expertise to develop solutions. We certainly have laid out a clear path of recommendations for how New York can reduce child poverty by at least 50%. We know it can be done. And so in New York State, we have made some progress, in particular with the budget actions last year. So we're really thankful to Governor Hochul and the legislature for some of the changes that were put into place to support children throughout our state. This, of course, includes the historic expansion of New York State's child tax credit. This will bring new $1,000 credit for children 4 years of age or under 4 years of age, and also increase the credit for older children. So if it has the effect of essentially doubling the amount of credit available to families in our state. Also, most importantly, or I think, is it also made a significant policy change to make that credit, the way it is implemented, a bit different, to make sure that those with the lowest income are now able to access the maximum child credit. In addition to the child tax credit, we're pleased with the expansion, and now we have universal free school meals in New York State. We also were pleased, we are just about to implement a new birth allowance in New York, referred to as the baby benefit, that goes into effect in just a few days. And also there was a $9 million investment in providing diapers and other supplies to new parents in New York State. So again, the council's recommendations provide a clear path for how we can reduce child poverty by 50%. We've started to take some actions. The path that the council has outlined is what we all believe New York State needs to continue to move forward with and further advance and expand on the work that's happened in New York to date. And of course, we are certainly challenged as New York moves forward. The federal government keeps trying to pull us back. So that's a combination of actions. There was the bill that was signed into law this past summer, July 4th. And then also, of course, the current federal shutdown that we are all dealing with. And I'll discuss briefly both of those to date. When Kate invited me to participate in this discussion, certainly did not envision that we would be where we are today. Certainly thought that the shutdown, if it occurred, would be over with by now. This is absolutely unprecedented in terms of what we're seeing and what's about to face families throughout our state, absent federal fix. So we know that there are a couple of places within our agency in particular that are currently impacted by the federal shutdown, and that includes both SNAP as well as the HEAP program. So with SNAP, we have been advised on October 24th, USDA indicated to us that November benefits would not be issued, and directed states to start taking actions and to not transmit any benefit files effective November 1st. So who does that impact? That impacts 2.9 million individuals in New York State. Of that amount, about 920,000 children and over 800,000 individuals who are aged 60 and older. And regardless of the particular characteristics of those, one thing that all of these households have in common is that they are either lower or no income households. And so the loss of SNAP is an absolute devastating impact on these households. So we are continuing to work to see what we can do in order to help prevent hunger to start happening within New York State. We know that SNAP is the most important and the most effective anti-hunger program in the nation. And it's true not only for New York State but for all states. And so this is something that is getting, within the past week, much more attention. I'm surprised it didn't get more attention earlier, but certainly the rhetoric, the news media attention to it, and others' attention to the issue certainly has increased significantly. Our agency is doing what we can to inform individuals. We have sent out, we not only have information on our website about the impact of the federal shutdown, we've also been texting SNAP households, and we'll continue to do that with a new round of texting starting tomorrow. We were hoping to avoid that last round, which is letting them know that their November benefits are in fact interrupted. But at this point, it looks like we will move forward with that last round of texting tomorrow. We also want to make sure that people also do know that the benefits they have are safe. They can continue to redeem SNAP benefits that are available. However, and they can continue to apply, districts are continuing to process, but benefits will not flow until the federal government takes action. We have a little bit of hope that Attorney General James, as well as 24 other state attorney generals, have filed a lawsuit seeking for an injunction to force USDA to access contingency funds that are available, in our opinion, are available to support SNAP benefits. Just earlier today, that was before the court, and the court is expected to actually issue something later today. So certainly that's something we're paying an awful lot of attention to, and certainly hope that at a minimum, that's something that USDA would do, which would permit us to issue at least partial benefits. With respect to the changes that, and I'm sorry, just quickly on the federal shutdown, HEAP is another program. Right now we've had to, and that's the Home Energy Assistance Program. It provides help for families and individuals to meet their heating bill costs. So it's direct payments on their behalf to help cover energy costs to keep their homes warm in the winter. We've had to delay that opening. Right now it's scheduled for November 17th, but if the shutdown isn't ended within the next couple of days, we will have to delay that even further. Another really significant resource that low-income families have certainly relied on year after year. With respect to the bill that was enacted over the summer, it included some really significant changes to SNAP also. It included cost shifts, so shifting from what were federal obligations for SNAP onto the states, and it also included provisions that will reduce SNAP access. The cost shifts are, for the first time ever, will require states to pay a share of federal SNAP benefits. And it's scheduled in a way that it's connected to states' error rates. And so the party line around this is that it's to reduce waste, fraud, and abuse. But that's not what error rates measure. Right now, based on New York's error rate, we believe that there would be a required contribution from New York for about 1.2 billion. So our error rates fluctuate. Certainly they went up after COVID with the staffing crises as well as the increased need. We've been working to bring those down. I can assure you that some of the extremely late guidance provided by USDA on these provisions and their implementation, combined with the shutdown, combined with the elimination of our waiver for the time limits, is certainly going to lead to errors. So we are definitely concerned. In addition to the cost shift, so there's both the benefit shift, there's an administrative cost shift that hits us as well as the local governments. But also the time limits, I think, is an important one to focus on because it will affect over 400,000 individuals in New York State. On October, I believe it was October 3rd, USDA told us that our waiver that we have of these time limits and work requirements that was scheduled to be in place through the end of February of 2026, they revoked that waiver effective in 30 days. So our waiver of those provisions is now expiring on November 2nd. As a result, counties and OTDA, we have been needing to take action very quickly in order to implement these requirements. So it does require people to participate in certain activities, a certain number of hours in order to maintain their SNAP benefits. So again, just restricting access in a way that we feel is just not the appropriate way to help folks enter employment and to move forward. Another really important change from HR 1 was a provision that further restricts the extent to which any legally present non-citizens are able to access SNAP benefits. So those provisions, we have not received any guidance from USDA on that, but we are expected to have to implement those provisions any day. We are actually very surprised that we haven't been given implementation guidance yet. And we do anticipate that will reduce access for about 38,000 or more individuals in New York State in terms of their ability to access SNAP. So in addition to the funding shifts, we are looking at a loss of more than 900 million in SNAP benefits flowing into New York State as a result of these additional restrictions. Just today, I just want to quickly take a moment to cover what happened earlier today. Governor Hochul announced an emergency declaration in terms of our need to make sure we are prepared to take action as needed due to the upcoming lapse in SNAP benefits. She also announced additional support for the emergency food networks. She announced 40 million in additional funding for the Hunger Prevention and Nutrition Assistance Program, or HIPNAP, and that provides funding to food banks, food pantries, et cetera, so that they can help additional households access emergency food. And she also announced a $25 million new investment in Nourish New York, which provides surplus agricultural products to food banks and others throughout the state, also just to increase the availability of emergency food. So there's a lot going on, to say the least. We have clear challenges ahead of us, but we too are thankful that we are in New York, and we know that we have a governor and legislative leaders and lots of community leaders that do care a lot about vulnerable households and low-income households included. We're thankful for that. And we certainly want to be a part of the solution as well. So I know our agency has been working tirelessly to do what we can to soften the blow, and we're continuing to explore options to see what we can do as we move forward. And, you know, in addition to just the current the current crisis with respect to the shutdown, certainly also very much look forward to working with Schuyler and others as we look forward and take actions to implement new programs and increase access to existing supports for families so that we can, in fact, reduce child poverty in New York State. Thank you so much.
Oh, thank you too. And I know you've been, your head must be spinning from everything that's going on. It seems as though so many of the sort of quick turnaround and significant impacts are of the federal action are ones that your agency in particular is dealing with. So thank you. And I know,
yes, of course. Thank you.
We've heard you on the radio. We've heard you meeting with different groups. So thank you so much for sort of being as open and transparent.
Absolutely. Thank you, Kate.
Next up, we are going to hear from Maria Doulis, New York State Deputy Comptroller for Budget and Policy Analysis. Yay. And Maria, we're so happy to have you. We're so appreciative of your and your team's fantastic series, New Yorkers in Need, and all of the other work of your agency to really think about what are the infrastructure that New York needs, especially to help those who are most in need.
Thank you, and thank you for having me. Longtime admirer of the Schuyler Center, both as an analyst for your sharp, research and analysis, but also for your advocacy as a New York mom. So thank you very much. And thank you to the commissioner for that very, very timely update. And I think excellent overview of how, what the changes are affecting SNAP and LIHEAP and some of the other programs. I think I'm going to kind of zoom out and talk a little bit about the macro view and put some of these in context, because the changes affect not just SNAP and some of those programs, but also healthcare and a bunch of other areas. And so I really want to talk about how critical federal funding is to the state budget and the services the state provides, and how the changes that are coming through are not a blip. It is really what we see as a change in the fiscal relationship between the federal government and states, and the state through its budget process is going to have to contend with a lot of changes. So just to level set, I think for everybody, in the current fiscal year, state fiscal year 2026, the state expects about $94 billion in federal receipts. And the overwhelming majority of that funding is for safety net programs, right? It's for Medicaid, it's for TANF, it's for school nutrition, it's for many programs that benefit kids and families directly. And in any given year, federal funding is about 35 to 40% of the state budget. And it's long been that the federal government provides the backbone of that safety net, right? Not only from a moral perspective, does it make sense to have a floor for everyone in the nation, but from a public finance perspective, it is optimal for the federal government with its taxing capacity to be able to gather the resources and target them to the most needy, right? And so, since January, there has just been this flurry of activity. And I think we have started to look at this and think about what it means fiscally, but also from a governmental perspective. And it is clear that the actions that are being taken are meant to shift this fiscal relationship between the federal government and states. So what do I mean by that? Really what is going on, what the outcome of the actions has been to reduce or limit or reverse even the federal government's funding or responsibility for some of the key social net, safety net programs. And it's really happening along kind of two fronts. One is administrative and executive actions. So the Trump administration has a very bold view about the executive's powers and has taken action on funding, right? From almost the first day of their administration, there have been pauses, reviews, terminations, even clawbacks, where New York City experienced funds being taken out of its bank account, which is something that I have certainly never seen in my time in public finance. There is an aggressive move to roll back regulations, particularly in the environment, many of which are the basis for states to take action on issues like climate change. And then there has been restructuring of government agencies and offices where some of these have been merged or eliminated or have had headcount so severely reduced that these agencies can't actually operate in the manner that they're accustomed to. So they have been severely limited. And wrapped around all that, of course, is a lot of litigation, which makes, both tracking outcomes and the transparency of outcomes difficult, but yields a lot of uncertainty. But I think the message from this is that, the states should expect less from the federal government. And I think no more is that more true than or evident than it is on the statutory changes that are starting to happen. The first, of course, and most important to date being the federal reconciliation bill in July. So that made changes not only to the SNAP program that the commissioner is talking about, but also to many of the to the Affordable Care Act tax credits that are used to back the essential plan and also to Medicaid. And, it's fortunately, I have to remind people, that's not the last one. There are more appropriation bills coming. If, the past isn't a prologue to the future in some ways, then, they will be taking up items from the president's budget, which severely reduce funding in education, housing, and other areas, right? And kind of failure to come to agreement on that is why we now have the shutdown. I would say the shutdown in some ways is another tool because unlike, one, it is on pace. The commissioner is right that it is unprecedented and they're kind of on pace to be the longest shutdown in record. But also they have they have said they may not actually pay workers back pay and that they will be implementing reductions in force and permanent layoffs, which again, just go to bolster the priorities that they're taking administratively. So I think it's worth taking a moment to discuss the reconciliation bill. In broad strokes, it increased the debt limit by $5 trillion. It made tremendous cuts to revenues through taxation. It increased spending on immigration actions. And then it made cuts to spending on healthcare and, like we said, nutritional assistance and energy. And so, writ large, this was accomplished by restricting eligibility for the programs, by pushing costs down, as the commissioner explained to the states, or even creating conditions that would require revenue losses by capping some taxes or limiting reimbursement for other programs. I think rather than kind of drill down programmatically, I thought it might make sense to say, what does it mean for kids, right? And so the tax benefits really overwhelmingly skewed toward affluent households. Yes, there were broad-based tax cuts, but the majority of the benefits there will flow to upper income households. There were some tax credit changes that Sophie can talk about in a little bit that were a mixed bag, and some deductions that benefited working people, like for overtime or tip pay. But writ large, those benefits flow to the affluent, and the benefits for lower and working class folks are really going to be trumped by these cuts to the safety net. And those impacts have really cascading effects, not just for households, but for businesses, for the medical system, for the state budget and finance. So, what we expect to see is an increase in food insecurity, more people being uninsured, strains in rural and safety net hospitals, additions to state administrative burdens and added costs. And just to throw kind of a few, I think, compelling factoids out there, we are a state that has one of the lowest uninsurance rates in the nation, right? Something to be proud of. We have robust public health insurance options in Medicaid and the essential plan. 44% of New Yorkers are enrolled in these programs. And as a result of the changes here, the estimates are that the number of uninsured will more than double, right? There'll be losses, heavy funding losses in the essential plan and in Medicaid, which will affect financial viability of hospitals. We have 1 million kids on SNAP, 300,000 people are going to lose some or all of their benefits under this bill, even as the state is then asked to shoulder additional costs for administrating the program. So we still have 1 in 8 households that are food insecure in our state. So they're really, it's a complex amount of changes, a lot of changes. They're being phased in over time, as the commissioner said. Some, it's unclear how they'll be implemented until regulations come out. But what is clear is that they are, very large in scope, and will have a tremendous impact on the state financial plan. So as of July, the state projected, about $34 billion in budget gaps for the financial plan period. So that's a cumulative number, not a one-year number. These changes, which will add to recurring costs and funding gaps every year, the division budget has not recognized that in the financial plan yet, but has produced some sort of estimates for what this could cost. And we layered the two on top of each other and found that those gaps could grow to $47 billion. Now, as a share of general fund balance, those are budget gaps that the state hasn't had to contend with since fiscal year 2010, when they were trying to manage the global financial crisis and the reduction in revenues. So it is really a daunting challenge, and it's one that the state will have to manage in an environment of kind of heightened economic uncertainty. So the good news is, to date, revenues for, tax receipts to date have been meeting expectations and even doing a little bit better. That alleviates a little, the short-term fiscal pressure. But in the long term, there are really economic risks out there relating to tariffs, to inflation, to permanent, economic impacts from the shutdown if people are laid off, to tourism. I mean, there are many risks out there, some of which are already being felt in communities across the state, and which may even grow over time. And so the state is going to have to manage these fiscal impacts across time, across fiscal years, and across these programs. And again, there may be more cuts coming later as Congress completes its work on the other appropriation bills. So, some of the cuts affect people, but don't affect state finances necessarily. They're, what we call gap neutral, but they have very real world impacts. And so, lawmakers are going to be faced with very hard choices. I think they're going to have to be trade-offs. And while the state does have reserves, it would be appropriate to use those reserves for a blip, right? If this was a blip and it was a temporary thing, dedicating reserves to it would be helpful and could potentially solve it. But you can't use the reserves to deal with this long-term restructuring in whole, right? So I think today or tomorrow, the state will be releasing its mid-year update. We'll get new estimates on how revenues are looking, expenses, and potentially some of the, the federal impacts will be realized in the plan. So we have a better and up-to-date sense. And I think the governor and her team have been really good at being transparent with the public about what the implications of this will be, not only writ large financially and fiscally, but in communities across the state. And I think now is a great time to also begin to present a strategy for how the state could begin to think about dealing with the trade-offs that will definitely have to, be made present to solve budget gaps later on.
Thank you so much, Maria. And I think we'll circle back to the, your final point around a strategy, because that's part of the reason we wanted to have this conversation, is so that our colleagues and partners in and outside of government are thinking now about what that strategy can look like. It feels as though so much of what has been happening is just chasing after the latest thing, and we're at I think an important moment where we need to also be thinking very strategically as well. So thank you. And I promise everybody we're going to come back with some questions, and I'm so excited to introduce Sophie Collyer. She's the research director at the Center on Poverty and Social Policy at Columbia University, and a longtime collaborator and partner on all kinds of issues, especially related to economic security, economic mobility, and our focus on ending child poverty. So Sophie, welcome.
Thank you so much, Kate. And also just thank you to the Schuyler Center for convening this webinar. I don't think it could be happening at a more important time. So thank you and for all the work that you all do. And to Maria and the commissioner, those remarks were so wonderful. And also now I don't have to explain certain things about the intricacies of some of the HR1, which I really appreciated your summaries. So I think this moment is particularly important because we can really think about how policy decisions can either promote the well-being of children and families across the state or cause real harm. And like, that's the moment that we're in right now. And, when this webinar was first organized, as Kate was mentioning, we were going to focus primarily on the recent federal policy changes from HR1, the summer's budget reconciliation bill, and the consequences for children in New York State. But the government shutdown and the suspension, particularly of SNAP benefits, impending for this weekend, as just another troubling layer to this situation. So I'm going to speak both about what the data says about the consequences of HR1 for children and families in New York State, and then share some additional some data that we have about the potential consequences of the SNAP suspension and what is known and unknown in terms of that policy change. And then I'll just close with a little bit of a backdrop on the city and state's affordability crisis against which all of this is playing out. So I don't know if I could bring up my slides, that would be wonderful. Thank you. And yeah, so again, stepping back to thinking about the consequences of HR1 or the summer's reconciliation bill for New York City families and children, I think it's really actually important to step back and consider the consequences of actually the 2017 Tax Cuts and Jobs Act, because that was like the backbone off of which HR1 was built. And so many of the provisions in TCJA were set to expire, and that was part of the budget, not budget, but a tax code renegotiation and deliberation around HR1 this summer. And TCJA included some substantial changes to the tax code, as Maria was speaking of, and those benefits were heavily tilted towards the top of the income distribution. So this is a figure from some national data, but I want to assure you that the patterns I'm going to speak about here are also represented in New York State when you look at the data for New York. And what it shows is that about half of children nationally live below 200% of the poverty threshold. Half. Like, that's a staggering number on its own. And that's saying that about half have a family income for a family of four of less than about $80,000 per year. And TCJA, raised their family income by about $1,100 per year on average. That's okay. But it actually raised the income for children at the top end of the income distribution for children and families by about $10,000 per year. So that was 10 times the benefit was received by families below 200% of the poverty line. And this is just like this is what was in place before the HR1 was passed. And then we think about what did HR1 do to add on top of this? And if we could go to the next slide. And it really maintained many of the tax code changes instituted under TCJA. But it also did things like increasing the value of the child tax credit, but making no other changes to the credit structures, which left the full value of the credit just further out of reach for low-income families and children. And I'll speak about the mechanics of that in a moment. So there was this kind of expansion to the CTC, but not for the kids that would benefit from it the most. And what actually they were going to also be affected by were these multiple changes to SNAP and to Medicaid that the other presenters have spoken about so far. So these gains that were heavily tilted towards the bottom, towards the top of the income distribution, and just losses for those at the bottom. And again, there were many other changes, but here I want to speak just more specifically about what HR1 did to the federal child tax credit. So as many people on the many attendees probably know that the child tax credit is this large federal expenditure on children. It's one of the largest direct federal expenditures on children, but it actually leaves out children in low and moderate income families. They are not necessarily eligible for the full credit amount. And that's because the credit phases in with your income. And that's what this figure on the left shows. And the green line shows how that phase in looked under the pre-HR1 or pre-OBA policy. And a family of four needed $36,000 in income to qualify for the full $4,000 child tax credit that they might have been eligible for under prior law. But the Summers bill increased the maximum value of the CTC to $2,200 per child, but made no other changes to that phase-in. So you see the blue line actually just moves the point at which you qualify for the full credit higher in the income distribution. And this effect is true for all family sizes, and particularly even has greater consequences for larger families. And if you can see on the right that pre and the income needed to qualify for the full credit under pre-OBA policy and under the new CTC. And while there was about a $3,000 increase in the income requirement for a one-child family, it's more than $5,000 for a family with 4 kids. So this was kind of, again, delivering gains higher in the income distribution and leaving out those at the bottom. And if we could go to the next slide. And it increased the number of children ineligible for the full federal child tax credit. Under pre-HR1 or pre-OBA policy, we had 1 in 4 children were ineligible for the full CTC. But under the new law, that's risen to 28% of children across the country who are ineligible for the full CTC because their family income simply is not high enough to qualify fully. That's 19 million children. Now, people on the call might wonder, well, what does that look like for New York State? And the next slide does show these results. So that's actually 30% of children in New York State. So it's kind of above the national average at the state level. And there are particular congressional districts across the state where it's just even higher, where in the New York 15th, it's 56%. That's more than half of children are ineligible for the full CTC. Also, I just want to let any of the attendees know that if you're interested in, these are federal congressional districts, but any interest for either state senate or assembly districts, please let me know and we're happy to produce those. But you can see not only is there just this substantial share of children are ineligible for this credit, there's even greater disparities across the state. And again, this is one of the largest federal investments directly in children. And these are the same children that are most likely going to be affected by the SNAP and Medicaid cuts that have been spoken about so far. So that's kind of one piece of the HR1 policy changes that I think is really important to consider in terms of how benefits are tilted towards the top and just leaving those at the bottom of the income distribution just in such a more precarious and difficult position. And also just think about who, this is families with young kids. This is families where a child might have a disability. This is veterans are losing kind of many their exemption from some of the SNAP work requirements. Just how many people are going to be affected by these SNAP changes and the precarious positions that they're already in is really important to consider as part of the consequences of this bill. If we could go to the next slide, please. But there's also this added layer of the government shutdown. So we've been thinking a lot about how SNAP families might be affected by the government shutdown, particularly the SNAP benefit cuts, as well as the cuts to LIHEAP or kind of delays in LIHEAP payments that are likely going to happen in the coming months. And what's challenging here is just, it's a data availability challenge, right? Like we don't actually have the best data to reflect policy changes in a given moment. We don't know what 2025 is going to look like because we're still collecting data on 2025 at this moment. But what we do is produce a lot of simulations, like a counterfactual policy scenario where these policy changes have been implemented. And so one that our center director, Christopher Weimer, just put out just looks at, okay, what is going to happen to the statewide poverty rate when families lose just 1 month of SNAP? And it's finding that about 35,000 New Yorkers are just going to kind of automatically fall into poverty when looked at an annual framework as a result of that 1 month loss. Obviously, that could increase the more and more months that benefits might be delayed. But this is something we're really trying to work on because we want to quantify and deliver the policymakers and the public just a sense of the consequences of these policy decisions. So this is something I want to make sure you're all available to you all. I also want to note that these changes are taking place against this backdrop of an affordability crisis across the state. We collect data, particularly on New York City, and measure poverty in the city every year using something called the supplemental poverty measure. And here we show the New York City poverty rate over the past nearly 10 years. And you'll notice that between 2022 and 2023, the poverty rate increased. And the reason for that isn't actually because incomes were falling. It was because prices were going up and the poverty threshold and the cost of needs was going up faster than incomes were rising. So this is kind of a just snapshot of like how affordability is also affecting New Yorkers. And we know this is true across the state as well. And if we could just proceed to the next slide. And we've also asked New Yorkers about if they've had to cut back on basic necessities to cope with just inflation and high prices. And we're finding that across the income distribution, actually, people are cutting back on basic necessities, with overall 76% of New Yorkers reporting that they've cut back on either food, savings, transit, or electricity and utilities in response to rising prices. And if we could, so all of that's, that's a pretty grim picture, right? Like, and I think that's what we know. And that's, we're aware of that. But I have been thinking a little bit about what is like some of the inspiration for policy moving forward. And I really was thinking about CPRAC as an amazing example of the state's commitment to reducing child poverty. But also when you look particularly at the policy proposals that are included, many of them are about filling actually gaps that were presented in federal policy already. So if you think about the food benefits, if you think about the housing assistance policy proposals in CPRAC, it's really about filling those gaps. And I think that that's as Marie was saying, like what is going to be the position of the state in filling those gaps and shoring up the safety net going forward, because we know that the costs of economic instability for children and families are so high, but the benefits of maintaining stable incomes for families are also much higher. Well, thank you so much.
Thank you. Thanks, Sophie. That was great. Thank you all for your insights and for this sort of fuel to continue this conversation. I think we are going to, before we move to questions, we'd love to hear from those of you who are out there on the call, on the Zoom. And you'll find a link to a very quick one question Mentimeter in the chat. So please take a minute to answer the question and let us know what you're hoping New York State will do this year to support children and families. And I hope everybody can find that link to the Mentimeter. And we're just asking this one question just to sort of hear from you all. What's one thing you're hoping New York State will do this year to support children and families? All right, universal childcare, I see you. Ooh, right to food amendment, we see you. Better cost of living adjustments, COLAs. All right, This one person said, building more affordable family housing, lowering the cost of living, and increasing universal childcare. Love it. The Anti-Harassment in Reporting Act. Interesting. Tax the rich to feed families. Cost of living adjustment. Shore up food supports for kids and families, universal childcare and funding to support childcare assistance. Funding to support living wages for childcare workers. Woo. Affordable housing. More on childcare infrastructure and the wages to childcare workers. We hear you, childcare people. Yay. Continuous coverage of children's health insurance, right on. Secede from the union with other blue states. More peer support, interesting. Right on. We're still listening if you want to quickly type something in. Universal basic income, New York for all, SNAP for all, universal childcare, right on, okay. Well, these are all things that I think we know can support children and families for sure. So I guess I'll start by asking if any of our panelists, if you want to turn on your cameras, that'd be great. Do any of our panelists have comments on the Mentimeter responses?
No, I mean, obviously, I think they're addressing some of the significant costs that families incur, right? I mean, childcare, and the fact that a lot of the programs that we have either don't have a cost of living adjustment, or maybe it's not sufficient. But certainly, a lot of ours do not have cost of living adjustments. So certainly speaks to the needs of families.
One of the questions that I've heard people ask that I'm curious, and whether it's SNAP or anything else, I'd be interested in hearing folks think about or talk about, that we've been asked, well, what about can't counties, step in? What can counties do? And whether it's SNAP or something else. And I'd be interested to hear sort of how you see some of these federal actions impacting on our local governments and what role you think they can and do play.
I think I would just piggyback a bit on what Maria included in her presentation and comments. It's just that some of these programs really do require federal interventions, because the federal government not only has access to resources, but also can, they'll have to balance a budget the same way that states do every single year. So first I would say that, and then, local governments do a lot. It's a lot to expect that they would be able to pick up some of these big gaps. But I am certainly not the expert on local government finances. But just certainly, the more things can be done at the state and importantly at the federal level, I think is better just for all communities.
Yeah, I mean, I would echo that. The other sort of comment I would make is, counties get their revenues primarily from sales taxes and property taxes. And we know sales taxes can be very regressive, right? And so, to the extent counties would be having to increase those revenue, and property taxes are also a big concern in our state. So to the extent those are the levers they have to play with and move, they may not be the right levers to move to finance the benefits that folks are looking for.
Yeah. I think too, you know, the communities with the most need are often those with the least capacity to raise those revenues. So Commissioner Guinn, as you mentioned, you co-chair the Child Poverty Reduction Advisory Council, tasked with monitoring and making recommendations for the goal of cutting child poverty in half over the next 6 years or so. Could you talk a bit about the next steps for the work of the council, and how do we move toward those goals given the new financial?
Yeah. Yeah, you know, as you know, our last meeting, we focused a lot on ways that we can improve outreach with respect to the child tax credit, just to make sure that those who are eligible receive it, because, you know, we do good things, but if people don't know about it, aren't able to apply, it's not going to make a difference with respect to reducing child poverty. So that's one area that we spent a lot of time on, and that we will be working with the tax department to create good messaging documents around that, including, you know, making sure that people understand what you got last year, where you weren't eligible, or you were eligible for a much smaller benefit because of your low income. Things have changed now. So trying to make sure people are aware of that. But big picture with the council, I think that we will continue to advocate for the recommendations that the council put forward. You know, there was a very, very positive step put forward by the governor with respect to expansion of the child tax credit, but we know how effective that is in reducing child poverty. And so we certainly would like to see the council's recommendation there to move forward in full. But you are absolutely right. What's happening right now is going to make this advocacy more difficult, because we are at the same time trying to preserve what we have. It's a challenge, but, you know, the council is going to need to continue to work and to advocate where people have the ability to advocate, both inside and outside of government, and also, you know, maybe also think about some other creative, you know, different ways of looking at things, or different ways of funding certain priorities to help those recommendations advance. I mean, I think we all think they're critical. We need to reduce child poverty. It's a goal that so many share, but I also, you know, would be remiss to not say that the current federal landscape is making this much more of a challenge. But I don't want us to stop advocating and stop trying to think of other solutions to help New York State advance.
You know, one of the things I'd like to see our policymakers think about is sort of put every policy and budget decision through a lens of how will this impact on, you know, children and families who are, you know, really struggling, or who are experiencing poverty. To really think about that in the context of to intentionally think about that with every single policy and budget decision. I think one of the reasons we thought it was important to kind of start really pounding the drum on that was, you know, after the financial crisis in 2008, 9, 10, you know, child poverty spiked, and it didn't, when the economy started humming along again, child poverty didn't get better. So what I think what that data told us is we need some intentionality. You know, we can't assume that there'll be some sort of a trickle down, or, you know, that just because when things are, you know, so even if things come back, I think I'd like to see us be really intentional, and see our leaders be really intentional about, is this decision, how is this budget or policy decision impacting on child poverty? Yeah. So for any of you, so many of the funding reductions and policy changes coming from the federal government very specifically target our immigrant neighbors, you know, and I'll say legally present, because in general, federal funding hasn't mostly covered undocumented people anyway. So whether it's health, food security, early childhood education, immigration enforcement, we know that 37% of New York's children live in immigrant households. That's well over 1 million children. And so knowing that sometimes we consider policies and funding in silos, how should policymakers and advocates sort of think about our immigrant children or children in immigrant families holistically? What can we be doing as a state, as nonprofits, as communities to begin to address specifically the cuts that are facing people in immigrant families?
Well, I think I can start us off. It is very clear that the policy changes in the federal bill were designed to exclude classes of immigrants from these programs. And to your point, I'm glad you mentioned it, the notion that there were undocumented people receiving these federal benefits is false. There are undocumented people who are eligible for emergency Medicaid to cover, those expenses. They are 1% of the Medicaid budget, and they are used by women who are in labor and delivery. That's like the preeminent expense, right? And quite frankly, that's less of a kind of moral, let's cover them, and more of a, we need to provide this cushion to hospitals who will treat them anyway, right? To make sure that they don't have financial losses. So, it's clear the changes were designed to do that. And for New York, they're particularly impactful because we have so many immigrants here. And I think we have done work in the past at the Comptroller's office, and will continue to press the case that immigrants here are not just part of our history or our legacy as a welcoming place. They are fundamental to bolstering our population, to keeping communities vibrant, and also to our economy. So we as a state have not returned to the size of our workforce that we had pre-pandemic peak. We are still down. You have 4.6 million immigrants in this state. They are in the workforce at greater rates than Native Americans, native residents, right? Citizens. And they are huge shares of the workforce in critical industries, right? Construction, healthcare, transportation and warehousing, agriculture, where you do have a significant migrant and undocumented segment of the workforce. So if these deportations and these actions and the disincentives and the culture and the fear that is created, it reduces that immigration, right? Or those numbers. We were talking about widespread economic impacts in communities, right? Not just like in communities, but also in the economy, being able, and to the extent there are certain occupations and industries that are experiencing shortages now, those shortages will be felt to a much greater degree later on. So, there is the kind of moral case for standing by immigrants, but there is a very strong economic case as well.
Thank you. Thank you, Maria. Go ahead, Sophie.
And I also just wanted to kind of note that there's the additional potential of just chilling people away from services and benefits that they might be entitled to, right? So the kind of culture of fear and intimidation is, well documented, and we're seeing it on the news every day. And so what is that going to look like in terms of kind of pantry use next week, right? When SNAP benefits have dried up, but people are also afraid of leaving their homes. And people who may, like US born individuals, afraid of leaving their homes by way of, because this intimidation is not necessarily well targeted in any way. I've been thinking a lot about that, particularly because during COVID, what we most saw was like the sharpest increase in pantry use of non-US born New Yorkers. And what that will look like in the coming months might be different than the profile we saw, where pantries were providing so much support during COVID and might not be able to provide that support because of fear.
Yeah, thank you. One of the things, I think we're all kind of, data geeks, and I'll start with you, Sophie. The federal government recently announced that it wouldn't be releasing the annual household food insecurity report. So I wonder if you could speak about what data gaps like that one will mean for states, and how we sort of work around them, or assess what's going on in the absence of some of these data points.
Yeah, the suspension of the food security supplement is a real loss in important data on how people across the country and within states are faring and able to keep food on the table. And again, it could not happen in a more problematic time where we're very much in fear of people losing, food insecurity increasing, but won't necessarily have official data to demonstrate that. It is a loss. We have been thinking about at the center how we might be able to fill those gaps using other data. So for example, we just released a report last week where we predicted the rate of food insecurity nationally using data on unemployment, food-related inflation, and poverty rates. And that model is producing in prior years pretty accurate estimates of the rate of food insecurity nationally. Knowing that states really want this data too, we are moving towards developing models where we might be able to do that at the state level. It is not the ideal replacement for a consistently measured data on food insecurity, but it might fill that gap temporarily. And we actually released that report because the annual food security supplement report was supposed to come out last week, but didn't because of the shutdown. So we're already seeing the shutdown has kind of fast-tracked that data gap. But we are trying to be creative and think of ways to fill those gaps. But again, there's no perfect replacement for that vital data. And those kind of methods only work if data on inflation and unemployment and poverty continue to be released. And absent that, we're really operating blind.
Yeah, thank you for trying to fill the gap. It's really helpful because, as policymakers and advocates, we all, we need the data. We need to understand and to be able to articulate beyond, obviously case-specific stories are always compelling and really helpful, but we all need to know the big picture so that government and others can take steps that are needed to address the need. So thank you.
Happy to. And if you all have any questions about that, please reach out. We're happy to share anything.
And I think we put something in the chat. So if folks want to see that latest, please follow that link. We have an audience question, and I think this is about the shutdown. Commissioner Guinn, can you talk a little bit, and I think this is wonky because I think I've heard you answer this. Can you talk a little bit more about why the governor is funding food banks instead of SNAP directly?
Yep. So right now, the investments in the food banks and other emergency feeding, that is kind of the step one, a way that people can get immediate help. We're looking at other options in the event that something isn't done at the federal level immediately. As I mentioned, it's $650 million every month that New Yorkers have received in SNAP benefits. So it is a large dollar value that the federal government has made clear that if states step in, that the federal government will not reimburse us for those expenditures. But like I said, we are continuing to look at every option. Very surprised that we are where we are today, and that my understanding is that the Senate has gone home. Never thought we would be here. So we continue to look at other options, but that was kind of a first step, a way to get food out quickly, especially Nourish New York. I know that they can distribute that food very quickly to the food banks to fill the gap. One other thing of note is that SNAP benefits are not all issued on November 1st. It is a rolling issuance. And I certainly don't mean to undermine the seriousness of this because it is extremely serious. Some households are going to be affected on the 1st, and then and then more on the 2nd, more on the 3rd. So I guess I would just say, stay tuned. And we really are hopeful that something will happen to force federal benefits to flow. We believe that the White House can take action in order to permit states to issue SNAP benefits.
I want to a little bit focus on what are some of the things we think that New York can do, especially as we look forward to the budget coming out and things like that. So I'd like you all to sort of think about, one of the things that's been identified are there ways to reduce administrative barriers, make sure that for any kind of programs and services, and maybe on the tax side, boost up assistance and tax prep assistance and things like that. So if you can think about that, and then I want to also just Commissioner Guinn, you mentioned the baby benefit, which was in last year's budget, which gives public assistance recipients a one-time $1,800 benefit upon the birth of a new baby. Can you tell us a bit more about that and how implementation is either rolling out or about to?
Yeah, I'd be happy to. So as you said, it's a $1,800 benefit that will be issued to anyone who's receiving public assistance in New York State following the birth of a child. So as soon as that child is added to the case, the district's notified, then the payment will also be issued. It is intended to, the obvious, helping families meet what are, new costs that come with having a child, just something, something to help reduce that financial stress that parents often face or caregivers face when bringing a new child into the household. It is being implemented. We have regulations that are out there that should be, we've closed our comment period. They should be implemented and effective on November 5th, which is also the date that we have instructed districts that is the date that they will begin to issue these benefits, which is consistent with what was expected with the statutory provisions that enacted the baby benefit. So, we're happy to be able to offer this. We do believe it would be helpful. And we think the implementation, this is another one this is an easy one to implement.
Yeah, that's great. That's fantastic. And then I don't know if this is, if anybody wants to take this, one of the questions we have is it time to suspend the local tax cap on local governments to allow for additional local revenue raising? Anyone?
Hey, I can pivot not to that when I answer that question.
Okay.
Of my pay grade, legislature, governor, they can just ask that question and answer it. But to kind of pivot back to your earlier question,
Please.
I think, when considering this, you have to look at all the tools at your disposal. And I think today's example about accelerating and adding money to Nourish, which is an effective program, is a great example of that, right? Just to look at what you have available and to say, like, what's working, let's double down on what's working. And that seems like a wise investment. To ask the question, well, what's working, but could be made even better, right? Were there efficiencies that could be gained? And to, adding a shameless plug for our office and the audits that we do that are geared, are conducted exactly with that sort of lens to say, like, yes, good, but what, could be even better, right? Let's try to make it work it be more cost effective and more efficient. And then I think there's also the tough question, but a necessary one, and that's what's not working, right? And I think there's often a reluctance to do that, and all programs have constituencies, right? But sometimes it's better to say, well, this program is not as well targeted as it could be, right? If we look at the data and we assess services and look at the ecosystem, this is a program that could be adapted, or where some of the functions could be transferred to other, benefits or services that are working better, right? And so I think kind of this laser focus on efficiencies and operating better and moving resources to whether they can be both more targeted and cost effective is a kind of good place to be. And in that vein, I think one of the tools that the research has showed us is very effective is the EITC, is the child tax credit. The state took this great step to decouple from the federal tax credit with its own child tax credit, right? So not only thinking about the spending side, but also the tax code and what's necessary there to improve some of these credits and make them even more impactful.
Thanks, Maria.
And just building on that, I think it ties back to what you were saying earlier, Kate, of like how when you're looking at every decision, are you thinking about how it's going to affect children and families, and particularly children and families in poverty. And in part, that's thinking about the cost of those programs and how they're how to make them most efficient, but also thinking about the long-term benefits that come from all of them. We know things like the child tax credit, the long-term benefits to society from $1 of CTC are like 10 to 1, because you're improving children's health, you're improving their earnings in adulthood, you're reducing like criminal justice system involvement. And the same is true when you think about childcare. The same is true when you think about paid family leave. All of these yield huge benefits to society in the long run and to the economy in the long run. So I think it's taking that, when you think about what is this going to do for children and families, it's what is it going to do for children and families today, and how is it going to set them up for the future? And it's making sure you're assessing the the contributions of a policy with that lens.
Thank you. And a plug for the Center on Poverty and Social Policy has done some of those analyses that show sort of a return on investment that we would get as a state by reducing child poverty. And I think that's a great point, not only asking our policymakers to think about every policy with regard to its impact on children and families experiencing poverty, and asking our policymakers to sort of break out of our existing year to year, but really usually what we're arguing about with some of the policymakers is, well, what's the ROI this year? What are we going to get out of that this year? And understandably, we do our budgeting by the year, but I think that's another thing that's a great point that we need to be making the case around. Can we please sometimes think about, let's put the money in now so that in a few years or some number of years, we will see what we're looking for. Well, I want to thank you all for being here with us today. We believe that New York is a leader when it comes to policies that address inequities and contribute to the conditions that build healthy and thriving children. And we are not backing down. So we agree, I think, that this is the time to keep doing what's right for New York's children, keeping them fed, housed, able to learn and play safely in their communities. So we urge our leaders to prioritize policy and budget decisions with special attention to those most in need and to long-term ROI. We need a special focus on young children, all children, people with limited financial resources, and the more than 1.3 million children in immigrant families. So we also know that all these issues are intersecting, and that we didn't even get to all of them today. So we're excited to kind of keep this conversation going with all of you. For those of you who have joined us today, we invite you to join us in this work. You can sign up for updates at our website, and we'll put this video out to everyone who signed up for this gathering. And on January 13th, we'll be holding our annual State of New York's Children's gathering in the Legislative Office Building, where we present data about New York's children. We too are hoping that the census site opens up again so that we have some refreshed data. But either way, we will be doing a State of New York's Children event in January. So before we leave, we hope you'll take a minute for hope, as we all need some hope to propel us forward. So please drop a word or phrase into the last Mentimeter to share what is giving you hope these days. All right, look at that. Universal childcare, progressive people, educated people are leaders. Yay. Support and increase in childcare assistance. We trained for this. This is why we're here, right? Universal home visiting. Oh, grocery shopping buddies. Nice. Oh. Keep bringing those hopeful messages. It's exciting to see. And we are also going to ask you, I said it was the last thing, we're going to ask, we have a brief exit survey. So we want to know if there are other topics or issues that you'd be interested in hearing about and talking about. So we'd like you to take that. And huge thank you to our panelists. And yeah, we can't thank you enough. I think really what we have in this world is our trusting relationships with partners. And we really appreciate you.
Thank you.
Thank you.
Thank you so much.